Destiny, I'm sure you've heard it before that there's a difference between listening and hearing. I've been accused of not listening well, but on a serious note, hearing is obviously one of our most important senses, so the health of our hearing and protecting that is so important. Joining us right now is Dr. Sabrina Lawley. She's an audiologist with Princeton Brookwood Baptist Medical Center, and she joins us this morning to help. Good to see you this morning.
Good morning. How are y'all?
Doing well. First of all, talk about preventing this, because we heard our parents say before, especially now with the ear pods, hey, don't turn that music up so loud. You're gonna damage your ears. Over time, does that take its toll?
It can. So you really want to watch the level of whatever you're listening to, whether it be noise, music. We think music is great to listen to, and it is, but it still can be considered noise and actually harm your hearing if it's turned up at a loud level over a long amount of time. So you really want to watch the level that you are listening to.
And we've heard, unfortunately, some tragic stories of some famous rock star singers who they've been affected by that years and years of the loud amps that are playing in their ears. But who is at risk, though, for exposure that are the most, issues that could affect their hearing later in life?
So later in life, with that type of noise exposure or just hearing loss in general, it can affect our ability to communicate and be involved with others. We're social people, so we really want to be able to communicate with others and have those conversations, be able to have our conversations with our family, with our friends. And when you have hearing loss, sometimes it can be very effortful. We have a lot of strain trying to just hear somebody, and so it can cause a strain on the relationship. And so maybe that person tends to withdraw, and then they become isolated, which can lead to anxiety or depression. And you just want to make sure that, that's something that we can help out with. So when you have a hearing loss, you want to make sure that you start with going to your primary care physician and letting them know, and then getting a referral for a hearing test, and then moving forward with that. And we start with hearing aids. Hearing aids are a great option when you have a hearing loss.
Yeah, we've certainly seen advancements in people protecting their ears, and whether it's headphones, if they're working on jack cameras, or even babies going with their parents to concerts and things, they now have noise canceling headphones. But you touched on some of the things you can get, including a hearing aid if they come to an audiologist. But how do they know exactly when to do that? And also, what about the advancements in the actual hearing aids to where they're basically invisible to most people?
So you really want to start with a hearing test as soon as you notice, hey, I'm having some trouble listening. I'm having some trouble understanding. Because the first frequencies to go are kind of those high frequencies, which is where our understanding can be. That's where the consonants are. The low frequencies tend to go later, and that's where volume of speech is. So if you say, I hear, I just don't understand, or people say it sounds like, Charlie Brown's teacher or principal, where they hear somebody talking, but they don't understand what they're saying, that's when you really want to start with that hearing test. With regards to hearing aids, the advancement, I have personally seen it. I've been doing this for close to 10 years, and I've seen the significant improvement from when I first started till now. And I've actually fit family members. So seeing them in the newer technology that we have, it's amazing. I actually fit my mom recently, and we went in somewhere, and she was like, I can't believe the noise reduction on this. Like, she was able to have that conversation with me, and we were in a pretty loud environment. So I've not only seen it professionally, but I've seen it personally.
Wow. And are the costs reasonable?
They are. I would start with checking your insurance, seeing if you have a benefit or not, and then again going back to having that referral for the hearing test, and then we go from there. We're going to try to get you in what is best for you at the best price possible.
All right, that is Dr. Lawley with some great information there this morning on your hearing, how to protect it, and some remedies for hearing loss as we start to age and that affects us. Dr. Lawley, thank you for your time.